I request Dr. Dhairya Pandit to please come upon the stage. And I request Dr. Harish Pausar, Dr. Sandeep Thakkar, Dr. Mona Shastri, and Dr. Ekta Desai to felicitate him.
Thank you very much, Dhairya Pandit sir, for your MOC. Very big consequences.
And continuing on snoring, snoring is not only a social problem, but has serious medical consequences. I request our next speaker, Dr. Sandeep Patel, to please continue his lecture. He has completed his MBBS and ENT from Baroda Medical College. He is a consulting ENT surgeon in Surat since
Tongue or pulling uvula. Only cutting down of uvula will cause cutting down of uvula will cure the patient.
No.
So over to Dr. Sandeep Patel for detailed description.
Good afternoon all. Today I am going to discuss about OSA. Everybody knows as a snoring. But snoring is just a part of it. It's just an alarming symptoms. Let's go inside. As you all know, snoring is the main symptom. The wife is always harassed by the husband when he snores and tell her, "Bhai, tu bija room ma sui ja, mare tai jo nahi su." And we have seen the case of divorce also because of snoring. I have such patients also. What is OSA? What people think? People think obese patients are OSA. The people who have daytime sleepiness, who have to wake up in the night, who has loud snoring, that is OSA. What is typical case scenario? Mainly patients come with the symptom, I feel asleep on the wheel. Matlab, the patient have a history of recurrent accidents, especially in the express highway or the road which is empty. So everyone who snores, if they have the habit of feeling sleep in the road, they should go for sleep study. The other is I love my husband, but I hate when he sleeps with me. Doctor, I'm walking zombie and I have seen 20 doctors and I'm not getting any outcome for this. What is snoring? Snoring is simple, a coarse sound made vibrations of the soft palate and other tissue in the mouth like tongue, turbinates and all, and which cause turbulence inside the airway causing inspiration. That is the definition of snoring. Snoring is disorder of obstructive breathing occurring during sleep. Snoring, we have mainly two things, apnea and hypoapnea. What is apnea? Apnea is ceases of breathing for more than 10 seconds, and hypoapnea is the decreased airflow, more than 70% decreased airflow. So total apnea, hypoapnea per hour gives us the index of AHI or RDI. OSA is very common, but it's dangerous. It is easily recognized, it's treatable also. What is significant OSA? AHI level decides the significance of OSA. If patient is having 15 to 25 AHI, it's mild, 26 to 40 is moderate, and above 40 is severe sleep apnea. Which symptoms, as you all know, snoring more common in men, less in females. Then witness apneas. Witness apnea, the wife almost say કે રાત્રે શ્વાસ અટકી જાય છે, અમે જોયું છે, but patient doesn't know that કે મારો શ્વાસ અટકે છે. હિસ્ટ્રી એ છે કે પેશન્ટ કહે છે કે મને રાતે ઊંઘમાંથી ઉઠી જવું પડે છે, વારંવાર બાથરૂમ જવું પડે છે, but actually the brain wake them up, otherwise something bad can happen. Insomnia, the patient એકવાર ઊંઘ ઉડી જાય પછી ઊંઘ આવતી નથી એ લોકોને. Daytime sleepiness is the main symptom. The daytime sleepiness, in fact, the patient is sitting somewhere, no work to do, he'll fall asleep. Any time a day. Fatigue, memory impairment, memory loss is very common. Personality changes, morning headaches, depression. Physical examination, ENT assessment, what we see the appearance of tonsil, uvula, BP, this is a vicious cycle going on. The patient with sleep apnea have hypertension and diabetes also. BMI. Many people say that the fatty person only snores. આપણે પતલા છે આપણે snoring નહીં થાય. But that is not the case. yes, obesity has more chances of yes, but we have the patient with BMI of around 27 also. They also snore a lot. Neck circumference, abdominal circumferences, abnormal size of mandible, nasal patency, tongue macroglycia. These are all the clinical findings. As you see in the pictures, in the pictures, you can, this is the just lateral view, the nose, palate, tongue, posterior pharyngeal wall, and the epiglottis. These are the four things which leads to snoring symptoms. This is a Fredman. This is an old grading, Fredman's palatal position grading. As you can see, the grade 1, you can easily see the tonsils. In grade 2, you can slightly see the tonsils and uvula. In grade 3 and 4, you can't see the uvula also. This tonsil size same, grade 1, grade 2, grade 3, grade 4. More the grade, more is the snoring. This is, as you can see, the patent versus collapsed airway. Here you can see the airway is open, and there you can see the palate and the tongue is coming in between, the airway is blocked. Physical examination, as you all say, this is Epworth sleepiness score. This everybody can do in their clinic. Just give this to the patient and ask them to tick. And if they will tick, we will get some scale also. And according to the scale, we can say them that their snoring is severe or mild. Investigation, the most common investigation is polysomnography. There are actually polysomnography, we can do EEG, EOG, EMG, ECG, everything. This is called level 1 sleep study. As you can see, there are multiple electrodes attached everywhere, over the chest, over the legs, over the forehead. This feels somewhat cumbersome to the patient who has come for the first time for the snoring. So I usually go for the level 3 sleep study. Level 3 sleep study can be done at patient's home. We send the person at their home. They just fit the machine. They come, and in the morning they can go and take the machine. This is level 3. This is easily comfortable as this. It has just three things to. One is the probe in the hand. Second, the chest lids, chest that tells you the abdominal movement, and what is the nasal prong. This is the one of the study which I got it from the level 3 study. As you can say, the BMI is 33.1. It's a high BMI patient. The snoring, the patient snores, snoring even is 3076, and the significant is you see the lowest saturation is just 58%. So when the patient snores, the OSA patient, the saturation goes down up to 58. In the ICU, you don't allow any patients to go saturation less than 90. But this is common at every day in his home. See the pulse rate; it goes height up to the 161. Tachycardia is so much. This is just a type 3 sleep study. This is another patient. See the BMI. BMI is just 27.1. But the AHI is 66. Here also the saturation goes down up to 69, and the pulse goes up to 125. The important thing is saturation less than 80% is around 47 minutes. So for the 47 minutes patient is having saturation less than 80%. So that is dangerous for the patients. After this, the patient asked me for the medicine. I told them there is no medicine, because what happens at night, the muscles of the nose, palate, tongue, epiglottis, they relax and it blocks the airway. So if I have to give the medicine, I have to keep the patient awake. You just get awake, there is no snoring. But if that is not possible, so there is a collapse at the level of palate. More lateral is more than the anterior. This I got from the DICE study. And in the nose, you can see the gross DNS, almost completely obstructing the nose, nasal cavity, with the turbinate hypertrophy. So this is the diagnosis. After the sleep study, we go for DICE, and then there is only two alternatives for the sleep apnea. One is CPAP and BiPAP. CPAP is a very good thing. I can say if patient goes for it, it's very good treatment. But the patient doesn't. They are not using it. And once the patient has taken, also they are not using daily. कि कोई एक बार पहन लो जो आज के बाहर गया तो नतु पहरियो. So in that case, that night will be the severe for the patients. બિકોઝ જો તમે પેશન્ટને રોજ તમને સીપેપ આપો છો તો રોજ એને ફ્રીમાં ઓક્સિજન લેવાનો ટેવ પડી જાય છે અને ફરી તો તમે એક દિવસ છોડી દેશો તો મસલ વિલ નોટ will respond as it was earlier. So CPAP machine is good, but once you have taken, you have to take it for the lifetime. What is CPAP? It's just a positive airway pressure. This is CPAP. CPAP is very good. Decrease MVA, decrease blood pressure, decrease daytime sleepiness. The problem is mass discomfort because it's same as like the patient sleeping. It's a non-invasive ventilator. તો પેશન્ટ એને કહે કે હું આઈસીયુમાં શું છે એવું લાગે છે તો પેશન્ટ એને નથી પહેરતું. પેશન્ટ એક્સેપ્ટન્સ ઇઝ નોટ ગુડ. ક્લોસ્ટ્રોફોબિયા, પેશન્ટને ભીડભાડમાં નહીં ગમતું બિકોઝ કન્ટિન્યુઅસ આખી રાત 8 કલાક તમને ફોર્સફુલી ઓક્સિજન જાય છે તો પેશન્ટને ક્લોસ્ટ્રોફોબિયા થાય. એરોફેબિયા, પેશન્ટ જ્યારે હાઇટ પર જાય છે તો પેશન્ટ ચક્કર આવી જાય છે ત્યાં. ધીઝ આર ઓલ ધ સાઇડ ડ્રોબેક ઓફ CPAP. CPAP is not bad, but CPAP, I have to tell the patient you have to use CPAP for lifelong. Surgical management for the children, there is only one thing for the sleep apnea is adenoids. If the child is snoring, just do adenoid surgery, he will be fine, he will be out of the sleep apnea. Nasal surgery, you can go for nasal polyps, nasal DNS and all those things. Zeta pedopharyngoplasty, this is the main surgery. What I do in this surgery, just pull the palate up and open it more than 180 degree. So the blockage is gone. In the tongue base, we go do tongue base channeling. Tongue base reduction I don't do because tongue base reduction I tried earlier, but the tongue regrows after 3 years. And the last thing is epiglotopexy. Epiglotopexy, I just epiglottis is just attached with the tongue base and it falls back, so the airway is somewhat open more. And the best is tracheostomy. Tracheostomy करना को sleep apnea जतु रहसे, but tracheostomy में sleep apnea tracheostomy advisable नहीं. This is also very good in the patient who is having retractnectia. The mandible is gone deep inside. Some patients might have. In that case, the maxillomandibular enhancement is very good. Genioglossus advancement we had done, but it fails after 1 year. Hyoid suspension also not good. For the mandible, only thing is maxillomandibular enhancement. Around 1 centimeter we enhance the mandible. Along with the mandible, the tongue base also comes up. So for the tongue base, the blockage, this is the best thing. Thank you.
Sir, after mandibular advancement, what happens to dental occlusion?
Actually, mandibular enhancement, I am not doing. The maxillofacial surgeon is doing. I am doing with Dr. Nehal Patel. They also do the maxilla and mandible both enhancement. And before the surgery, they have a 3D designs also prepared. And according to that, they just pull the maxilla mandible upward. And occlusion is always their priority because they are done by dentist.
Yeah, please.
They are just promoting all these things. So what's the scenario? Means are these devices are effective or maybe useful to some extent? What's your opinion?
The sleep apnea, there is a multi-level block at the nose, palate, tongue, epiglottis.
Okay, sleep apnea is the only, you can say, iceberg like that thing, right? Most of the people are suffering from this snoring. Yeah. So for
actually snoring is the iceberg.
Yeah.
Sleep apnea is deep inside.
Yeah, you can say in the reverse way.
And the device, there are many devices which are available in Amazon and everywhere.
Yeah.
The device doesn't work because the device is some device they apply in the nose. Just they pull the ala, nothing else. They can't do anything else. So by pulling the ala, if the patient has mild snoring, that might help. But those all devices had failed. Not a single device is helpful in sleep apnea and or for controlling snoring. There is one device which is under experiment and might come in 2 or 3 years. They are doing the stimulation of the nerves so that tongue is all pulled outwards. The continuous hypoglossal nerve stimulation is going on. That device is under research in US right now. but that device might come out in 1 or 2 years. That we think can be helpful for the cases where the tongue base is involved, where the tongue is bulky, for those obese patients. Otherwise, there's no single device which can help or cure sleep apnea. Those are just, I can say, time pass.
And second thing, sir, is there any exercises or you can say some yoga modalities which can help in preventing all these things?
For the
is there
mild-
any correlation? Means
Yeah.
you can-
For the mild disease, for the mild sleep apnea, say up to 15 or 20, in that case, I ask the patient to go for pranayam. Pranayam exercise, where all the muscles of the palate, nose, tongue base, those are used. So you have to contract. For building bicep, you have to do daily bicep exercise, then the bicep build in 6 months. If you do pranayam, for the mild cases, there is definitely you can get the results. But for the moderate or severe cases, pranayam don't help because the muscles are so much fatigued, so much gone, you can't do anything for that. People say that we walk on that treadmill, I run daily, but there is no improvement in sleep apnea. What happens? When they walk or they run on the treadmill, જ્યારે હાફ ચડે ત્યારે ઊભા રહી જાય છે. તો the muscles are not exercise થતું જ નથી. અગર તમને સ્લીપ એપનિયા મટાડો, there is only one exercise, મજૂર બની જાઓ. મજૂર એટલે એક બોરી લો, બોરીને 10 માળ ચડો, 10 માળ ઉતરો. મતલબ તમારે કન્ટિન્યુઅસ હાંફવું પડે. જીમમાં બી તમે જાઓ છો તો તમે ખાલી જરાક એક્સરસાઇઝ હાંફો છો તો ઊભા રહી જાઓ છો. You can't continuous તે કરી શકો. That is for the 6 months. For ideally જોવા જાય તો exercise helps, but not so much. In the mild case, it can.
Thank you.
જો હાંફવું જરૂરી છે.
હાંફવું જરૂરી છે.
Thank you so much, sir. And
Thank you, sir.
big round of applause. Yeah, thank you so much. So, thank you, sir. Thank you.